Hello, everybody. My name is Christiana, and I'm part of Indian Springs New Gen Peace Builders team. And this is our presentation about our project. We hope you enjoy. So, what exactly is our issue, and what is our project focused on? So, our thematic is COVID-19 vaccination disparities. Disparities in access to healthcare have been exacerbated by the COVID-19 pandemic, and with vaccines becoming available to more citizens, lack of access to clear and complete information and limited knowledge of online registration are making it really hard for people, especially in underrepresented communities of color, to gain access to vaccine. On this slide, you can see a chart which represents 14% difference, as you can see 38 for white people being vaccinated and 24 for African American people being vaccinated. And let's be honest, this is a considerable difference. And what this difference does is show that there is an existing gap between regarding vaccination accessibility based on race and ethnicity. Our team acknowledges that there already exist many efforts in Birmingham to address this issue. And some of them include Jefferson County Health Department, which is currently working with United Command to provide transportation assistance to certain vaccination sites. And most of UAB sites now do not even require an appointment. Jefferson County federally qualified health centers have also raised over 14 million US dollars to expand access to COVID-19 vaccines and build vaccine confidence in hardest hit and highest risk communities. However, our team still felt the need to address even more this issue, especially in terms of vaccine awareness and knowledge of where to get the vaccine. So what exactly is our passion and why do we care of this particular issue? Our team imagined ourselves in the shoes of people affected by this issue, and it really felt like being stuck in a car, slowly submerging into the ocean and not being able to get out of there on our own. People in such situation are trapped in a discriminatory healthcare system. And our team really cares about this issue because we believe we're all protected under the same human rights and each and everyone deserves access to health.
Since our project centered around vaccine information, we spoke with epidemiologists at UAB as well as officers in Jefferson County Department of Health, which both has more than 100 years of history as community health provider. An officer had helped us identify an area of the Metro Birmingham that has low vaccination rate and provide important resources and advices for our project for the gaps and inequalities in COVID-19 access and what is the most beneficial way to solve them. Simply put, our project is a poster about where and how to get a COVID-19 vaccine. When we speak with the officials, we learn that oftentimes the most vulnerable communities get their information in a local station that they frequently visit. This approach of posters has been used in Jefferson County communities such as Smithfield and Centerpoint by UAB testing centers and yielding great results. We choose Fairfield as our main focus because a large number of people living here has lived below the poverty line, and there have been low rates of vaccination rates among all age groups. We obtain the Social Vulnerability Index from the health officers, or SVI. The SVI has also been used by the CDC to find areas that need the most resources and aid and help us confirm that Fairfield is a perfect fit for the location of our project.
When we put our project to the SMART test, we believe our poster passes with flying colors. We have worked with the Jefferson County Health Department to make sure our project is addressing the exact issue in a prominent location. We plan to trace how many people visit the website through posters using a QR code to visit the Jefferson County Health Department's website and information. Our project is attainable and extremely relevant to today's most prominent issues. We plan to have the posters distributed by this time next week in high traffic and busy areas of Fairfield such as churches, schools, shops, and bus stops, to reach the most amount of people we can and to track the data in order to see how helpful it was across the city. By helping people who have difficulties receiving information to register and get COVID vaccines, we will try to build a bridge between the providers and the receivers of information and treatment. Through this project, we seek to address the structural violence that has made it difficult for some to get the healthcare that they need. So, what can you do to build a bridge between the two sides and help those that need to get vaccines? We would like your help in spreading the words about vaccinations in order for more people to get vaccinated and to create a safer environment. Share your experience with your friends, help them sign up, and encourage people to get vaccinated so we can return to a safe environment and a sense of normalcy and stay safe. We are thankful to our mentor for our peace project, Brunson White. Together, there are 13 Indian Springs students who participated in this project. You heard this morning that most of the projects were virtual. That was especially true for us because some of our students are international and contributed their ideas virtually when they were not in Alabama due to the impact of COVID-19.